commitment, only on KXAN News.
Welcome back. It is the most common form of cancer in men, striking over 200,000 a year. We're talking about prostate cancer this morning, and it is also Prostate Cancer Awareness Month. Dr. Kushik Shah with the Austin Urology Institute is here with us to talk about it. Good morning to you.
Good morning, Erin.
So let's start off with some stats to put this in perspective. Overall, 1 in 6 men will have prostate cancer in his lifetime. The diagnosis is rare before the age of 40, but increases dramatically after that. Prostate cancer is also the second leading cause of cancer death among American men and is the most commonly diagnosed, with nearly 240,000 new cases expected this year. That is an incredibly large number. And doctor, what's scary about this, as you're reading about it, the symptoms can almost be silent, not show up at all.
Right. And a lot of men come in, they'll ask us, well, why do I have to get screened for prostate cancer? I'm urinating fine. I don't have any problems. I'm not, my hair is not falling out, things like that people associate with prostate cancer. The problem is with prostate cancer, you're right, it's very silent, and you don't really realize that you're having symptoms until it's a late stage, almost untreatable prostate cancer. And typically those signs can, include urinary issues, back pain, and things like that. But by the time you have back pain from prostate cancer, that means the cancer is spread into your bones. So that's too late, clearly.
What is the magic number, the magic age when you should start being tested?
So the guidelines have recently changed. If anything, the American Urologic Association said, I think we've actually been a little almost too aggressive about screening people too frequently, too often. So we've actually come up with some new guidelines that suggest that if you're of an average risk of prostate cancer, you should get screened between the age of 55 and 70 and do that every other year. Now, if you're African American, you have a first-degree relative with prostate cancer, your father, your brother, that type of thing, then you should get screened a little earlier and also get screened every year. But that's kind of a conversation now the urologist or the primary care doctor has with each patient. We kind of tailor the screening for each patient.
And the good news is, if detected early, it can be treated and you can essentially be cured of this. Right.
The quoted figures are at 5 years, 100% of people are cured from prostate cancer. At 10 years, the cure rate is well over 90%. So you catch it early, you treat it, you can go on to live a normal, healthy, active lifestyle. And nowadays, with the advances in robotics for surgery and radiation-based treatments, there's actually several different treatment options. A big scary thing used to be the impact on urinary control or sexual function with treatment of prostate cancer, and nowadays with the newest treatments, we've actually minimized a lot of the side effects that men have traditionally feared with prostate cancer treatment.
And you also say there are a couple things that men can do that they can take to help prevent or lower the risk of getting prostate cancer.
Right, and the easy thing about what you can do to prevent or reduce the risk of prostate cancer, it's really things that you can do for an active, healthy lifestyle. That's reduction of weight, number one. Number two is eating a lot of greens, antioxidants. The other thing is eating a lot of reds, tomatoes actually that have lycopene. So a lot of it fits an active, healthy lifestyle, and also reducing red meat. So, these are things that you might hear for a number of cancers like colon cancer, but doing those things will reduce your risk of prostate cancer amongst other cancers as well.
All right, Dr. Shah, thank you so much for being here with us this morning.
Thank you very much.